Hi, Merete.
Hi, Serge.
So you've done a lot of work about what happens when we forget to feel.
Yeah, you're right. That is what I specialized in for many years. It's this concept of hypo-states,
Mm-hmm.
and I'll say a little about what that is.
Yeah. Yeah.
Because I mean, hypo-states can be found in the body in many levels. We can have hypo-states in organs. Uh, So it's a broad concept, but what I am specialized in is the muscle system and the autonomic nervous system, and using that knowledge in how we work with trauma. And what is special about the hypostates is that they are the ones we don't feel. They're the ones we forget. They're the ones that kind of fall out of consciousness, which makes them a very different challenge compared to the hyper states, where we go tense or we go very mobilized or we go in flight or fight or all that. That has a lot of visible energy in it. And with that, it's easier to track.
Yeah.
So I think that is the logic of why the hypo states have been paid less attention to, which
Because
they
they're
have.
because they're less visible, because in a way they don't
Yes,
exist, because we're not,
yes.
it's an absence.
It's, yeah,
It's perceived as an absence.
it is. And it's a genius strategy, because we get rid of something literally in ourselves. We don't have to feel it. And of course, that is a very, very practical strategy to have available in both inside traumatic situations, but also just in daily life. So these hypo states are part of how we can get out of inner dilemmas if some parts of us are not really welcome in a situation, or if we have learned in our childhood that these states or these skills were not welcome, what do we do with them?
Yeah.
And the traditional way is that we contract them, right? We control them, we hold them back. That's the tension. But the less spoken about strategy is that we make them flaccid. We literally take the energy out of them, or energy pours out of them, out of the muscles. And then we don't feel the dilemmas anymore, because it's as if they don't exist.
But what you're talking about here is we're not in that continuum of trauma, of saying this is something that happens only in trauma
Correct.
when everything else has failed. But you're
Right.
talking about it as
Yeah.
something that is part of an everyday adaptation to life.
Yes. And then it has that very broad perspective. And then what I have specialized is in seeing how this very normal strategy, what consequence does it have when we work with trauma,
Mm-hmm, mm-hmm.
right?
Yeah.
But the phenomenon itself is very normal. And I could give you some examples from in this Corona time. I am doing a lot of work online. I'm working with clients, I'm working with supervision groups. And with all of them, pretty much all of them, we go into a process of what is it that has happened to your presence in this situation? What are the stresses and how does it impact your body? So that we can get back into more fullness. And one example from yesterday is this client of mine from Canada who came in with just a lot of stress in her upper body, impacted by her work situation and unclarity around her tasks, and unclarity from the boss, etc. And what she was very aware of was the typical pattern of shoulders all the way up towards her ears. And then what I do is I ask her first to just settle into the chair, to get in contact with her feet and her sitting bones, allow some release of the tension. So it becomes less noisy, the tension, right? And then I ask her, so then please pay attention to where is it your body is not as filled out? Where is it has gone flaccid? Or which parts is it you have forgotten to feel? And then I ask her to make comparisons to help her. Now, this is a person who tried it before. So for her, it was quite easy. With other people, you need to train the skill to track it. Where is it? And you can do that by comparing body parts. Is there a difference between the back side and the front side of the body? The upper part and the lower part, the right side, the left side, the outside, the inside. These comparisons can help us to track where is it we are not really present. Not through tension, but through this flaccidity, which is a giving up. And what she tracked,
so I want to try to summarize some of what I hear to make sure that I'm hearing you correctly. Yes. So the concept is paying attention to the areas of flaccidity, first you were talking to this client about noticing the tension itself, because that overall tension can hide. You know, we only perceive the tension if that's there. And so paying attention to it, which helps relax it, then allows her to not just be focused on the tension that is very real and see underneath. And what you're pointing out is that the flaccidity is not necessarily a general state of the whole organism, but it can be localized. In fact, the way you look for it is to look at, perceptions of different parts of the body to notice which ones might be more flaccid than others, and therefore gaining consciousness of that flaccidity.
Yes, you got it. And you got this point of that when we're looking for specific parts of the body, it's even more specific. We are looking for muscle groups, right? Or even specific muscles that can be flaccid. Where if you have an overall hypo state in the whole body, you are very likely to be in hypoarousal instead, which would be an impact from the autonomic nervous system. Right? And we can come back to that later.
Okay.
But what I'm really wanting to try...
We're making a bookmark that there's going to be a difference between hypoarousal of the ANS versus that localized group of muscle or specific muscle.
Yes.
Yeah.
And the reason for going for that first is that that gives us a tool. Muscles you can impact. Muscles you can do something very practical with. And if you know what to do with flaccid muscles, how to invite energy back into them, you can have a chance to modify that defense pattern. So she tracked, this Canadian client I had yesterday, she tracked that she didn't really feel the lower part of her body. She didn't feel her feet and her legs. They were not filled out, which is a very typical pattern. You go all the way up here, and then something lower down is more gone. Could be feet, legs, it could be the center area. So then what we did was to, and that's the practical methodology, it's to bring in energy in a low dose. Because if we just bring energy in, a lot of energy, then you in a way polarize to the flaccidity. You try to kickstart it, which you may be successful in, but it's not going to change the pattern. Then you're just kind of pushing energy into yourself again, and then when you relax, you're gonna go flaccid again. So the whole technique is, how do we bring energy in a way that's sustainable, where the kind of the muscle relearns how to tolerate a higher energy level, and with that be able to access the emotional or psychological content.
Yeah. And so when you're talking about bringing energy, is it bringing energy, for instance, from the higher part of the body to the lower, or
Good
finding
question.
something?
No,
Okay.
it's bringing energy into those areas by doing something practical. Mm. And for example, with the feet and legs, you could do just a tiny little push with your feet into the ground.
Okay.
Just a tiny little.
And so I'm inviting people as they're listening, if you're sitting, to just notice. Obviously, you're not necessarily having no energy in your legs, but just to notice the difference of what happens when you dig in your heels.
Yes, yes. And now you say the heels. If you dig in with the heels, you will bring most of the activation up on the back side. If you use the whole foot, you will bring more energy into the center line. So there are all these small nuances to how we do it that will impact what muscular groups you are activating, and all of it can be resourcing. It's a question of who we are.
Mm-hmm, mm-hmm.
So that's another thing in it, is that I always ask people to experiment. I give them options, and then I ask them to try out what works for you, and especially to try out which dosage works. Because the typical pattern is that when you ask people to do something muscularly, they do it with a relative amount of strength, because that's what we were taught generally, right? So it's a training to learn to dose low, which would be right now to just try to do a tiny little, just a tiny little push with the feet.
Yeah, yeah. And
And
to have that
see,
sense of the system engaging.
yes, you got it. And it's exactly that sense of something engaging that I'm going for. And for some people, you can discover that you need to go to a really, really low dose to get that engagement. And if that's the case, it tells you that you are touching into an area where there is hypo response. Right? Or you can have areas where it feels it's fine. I like pushing a little with a little strength, and that gives me more fullness. So there are variations to dosing. Is really a process in the here and now.
Yeah.
And to do small, really small muscular activations that way brings energy in. And then if you don't do it too much and then let go, but you do it and then you let go very gently, then the energy stays there.
Yeah, so there's kind of a pulsing, a gentle pulsing.
Yeah. And that happens when energy comes in and it starts having a natural flow. You know, there's a little activation, there's a little rest. And I think that is basically a natural flow in the body. But it's that flow that we lose in areas of our body.
And so what I'm noticing as you're describing this, as I'm following your description of it, as I'm following in my body what's happening, is I'm noticing that, of course, it's not just the physicality of the engagement of the legs, but there's an engagement of the mindful part of the mind, you know, of that that gentle attention, you know, and that paying attention to the rhythm that also engages the mindful part of our functioning.
Yes. And you use the word gentle, and that is a key word. If we want to include and get to know and modify our hypo-responsive places, we need to do it gently. Because these places are the ones that they are really, really good at just going invisible. If we feel pressure there, we can just go underground. You know? And if we want to change that process, it's like approaching an animal that is withdrawing, right? You don't, and you have to do that with gentleness, and you have to do it gradually to be successful. And it's that you could say thinking or experience that lies in this concept of dosing.
Mm-hmm.
It's a very gentle activation that gives us the chance of getting out of kind of being at the mercy of the flaccidity. Because flaccidity really brings us into a more vulnerable state. The places where we are not filled out, we can't protect ourselves.
Mm-hmm.
We can't take action. We tend to go one down. We tend to go victim. So the whole process is about how do we bring energy back into those places so we can become in charge again. And we can take ownership of what is it that lives in me in those places. So
Yeah.
there's a lot of authority work in it. Yeah.
I wanted to just repeat something you said, that in this process, that gentleness, that slowness, that mindfulness corresponds to the experience of that curiosity about what is it, you know,
Yes.
that I can again take ownership of that potential power that
Yes.
right now has been switched off.
Yeah.
Yeah.
So I'll go back to that. If I go back to the example of the client yesterday, when she got energy back into her legs, the first thing that happened was that she got back her orientation capacity. So suddenly she could look at this whole situation with her boss from a much more resourced place. She could even start laughing about it. And she could start feeling the frustration that she had left. So part of what had made her go flaccid in her legs was that she didn't know how to or forgot how to contain her own frustration. So then going flaccid in her legs, she couldn't feel the frustration, but she lost her orientation and her capacity to impact the situation.
Right, right. So let's go a little more slowly there. So the thing there is the interrelated relationship with her boss is very, very frustrating.
Yeah.
And there's so much frustration that she simply cannot tolerate it. So
Yeah.
she automatically turns it off.
Yeah.
And as she turns off the energy in the legs, she's obviously doesn't have a leg to stand on and she's disoriented.
Yes.
And feeling again access to the energy in the legs
Yes.
helps the grounding
Yeah.
and helps orient.
Yes. And what gave the success was to do it gently enough. She did it very gently, right? Which speaks to the amount of overwhelm she had actually been in. So if I had asked her to get a lot of energy back into your legs, she would have split even more probably, or she would have gone overwhelmed in the session. So the success of the process was lying in doing it very gently and asking her to find the dosage that resourced her, which was very small. It was tiny little in the beginning. And then suddenly comes this moment where what you said before, that something engaged again in her legs, right? Suddenly she felt this experience, oh, I'm still here. My legs are still here. And it's actually touching for me every time it happens.
Yeah.
because it's like people get back to themselves. People re-find ownership of themselves. And then a lot of skills come back, right? Then she stands better on her feet, and then she can orient, and then we can start regulating the emotions. Where if we had tried to do that before she had re-owned her legs, it would be a very different process. Also between us, because then I would be, the risk of us going into dominant submission would be very high.
Yeah. So I want to maybe put this in a context of, say, other approaches to trauma. And it seems like in this one, you could say there's that sense of the titration, but
Yes.
the titration is really in engaging the resource while going into the trauma, so that it's not about having the resource then going into the trauma, but you're engaging the resource, which then allows you to feel the possibility of confronting the trauma. Or do you want to
Yes.
address that a little bit, similarities and differences?
Well, I think you get it quite precisely. That what you gain by doing this muscular work of regaining activity in the muscles that have gone flaccid is that you build up resources so you can relate differently to the trauma. In that sense, the trauma itself is less important. What is much more important is how you regain what you lost so that you can tolerate facing something that is stressful without losing yourself again.
Yeah.
In
So,
that sense, I'm not very interested in the stories.
yeah. No, so in that sense, you said,
Yeah.
in that sense, the trauma is less important because the
Yes.
focus is on regaining the use of the resource.
Yes.
Yeah.
Yeah. And with that, there's some similarity actually to Stephen Hoskinson. I heard a talk of him the other day, and I just found some similarity. And he speaks the same, that it's not the story in itself that kind of holds the solution, but it's finding the resources that start emerging and supporting them. And I think that is a parallel to what it is I'm doing, with this very specific focus on getting out of the loss of resources
Yeah.
that lies in the flaccidity.
Yeah.
Re-empowering the system.
Yeah.
And then the balance between the person and the trauma changes. I heard people say that so many times, that when they have more resources in the body, the trauma gets smaller.
Right. So I like to stay with that image, the balance between, within the person, the balance between the trauma and the resources shifts. So if we
Yes.
had a circle, a pie, at first the trauma takes the bigger size, but
Yes.
you build up the resource and then they expand and the trauma shrinks in that pie.
Correct.
Yeah.
Good image. And that doesn't mean that it wasn't a trauma,
No.
but it means that you can then be more curious about it, and also be more curious about what is still left inside this story that you would like to look at. But you can do it from a much more resourced place.
Yeah. But so again, the focus here is very much on engaging with the difficulty, the trauma, and so it's not understanding the trauma, it's building the resource that,
Yes.
with the idea that the resource itself will naturally take care of the trauma because you restore the
Yes.
organism's capacity to
Yes.
engage with what is too difficult.
Yes. And that's it exactly in that process I have found that this focus on the kind of the lost parts, the parts that have gone invisible, is very, very, very valuable, right? Because they are the parts that we so easily forget to pay attention to, because they are not noisy.
Mm-hmm.
Like the tense parts, they show up in the process. Where the flaccid parts, you actually need to approach them. You need to know that they are there and then ask about them.
Yeah. So maybe let's talk a little bit more about that, because by definition, it's very hard to notice them. And
Yes.
what you pointed out earlier is you said, okay, one way to notice them, well, if you have a habit of doing it, then you're going
Mhm.
to have markers and you can go back to past experience and compare it.
Yes.
But if you don't have so much of that habit, how do you do that? And you said, pay attention to different parts of the body,
Yeah.
some that are more tense, less tense. But do you want to elaborate a little bit on that for somebody who's never done it?
Yeah.
How do you notice the flaccidity?
Um, Basically, there are two ways. One is the comparison method that I talked about before. And most people can get some felt sense of if you have more energy up or down or back or front or right or left, or that's helpful for many people.
So
Then
let me just say. So then, if instead of focusing on is it flaccid or not,
yeah,
maybe the first level is to just say, okay, so I'm looking for where I have more energy,
yes,
and so then the others have less energy, and so it's
yes,
not necessarily calling it flaccid, but just
no,
saying I'm noticing the differences in the way my
yes,
energy is flowing.
yes,
Okay.
and then pay attention to those where there's less energy and give them some value. I think that's another very important part of it, because honestly, hypo states have low status in general. It's many people are ashamed of them. It doesn't feel good to be given up, right? So there's a normalization that needs to happen, an inclusion, a welcoming, a curiosity, to really include them actively. Do you get that? And that's part of the method. It's to give that conscious attention, give them value.
But so to use the example you were talking about your client from yesterday,
Yeah.
with certainly less energy in the lower part of the body.
Yes.
So in what sense is the experience of giving them value? Is it just, for instance, to say, "Oh, I want to pay attention to them," or what else is does the intention? How do you experience that intentionality?
Just the fact that I, as the therapist, ask her about, so where are the parts in your body where there's less energy? Just me asking that question gives them value.
Okay.
And that's what I pointed out before. It's that tension shows itself. Low energy doesn't. Hypostates don't show themselves. So somebody needs to reach for it, right? And when you do that, if you can do that from a neutral place or just a normalized place, I know they are there, these parts of the client. I know they are in me. I can also give examples. If it's very difficult for a person to find where they are, I'll give my own examples. First, to go first in normalizing that this is part of all of us.
Yeah.
If,
So
if
for
I did,
when you say you give your own examples, it would be to say, for instance, right now, I have more
exactly,
energy in my torso and
exactly,
my
yeah,
shoulders and
yeah,
less in my legs.
yes.
Okay.
Or if I did it right now, I could say that I am aware of this very typical pattern in me, where when I'm performing in a way, I have this tendency for tensing up in the outside of my legs. So I'm very much here,
Yeah.
no? And then where is it I go flaccid? I go a little bit flaccid, not a lot, but I do get a little bit flaccid on the inside instead. Right? And if I balance that, I get calmer inside. And how do I balance it? I changed how my feet are positioned on the ground. So instead of letting them go to the outside, I let them go to the inside and do a tiny little push with the inside of my feet. And as soon as I do that, I feel the engagement all the way up on my inside of legs, pelvic floor, front side of my body.
Okay. And so
And then I get a little happier, you know?
Yeah. And so
Yeah.
just in describing this, you have normalized it and you have shown what is good
Yes.
for and how
Yes.
to do it.
Yes.
Yeah.
And then there is there's this other way of if people have a very hard time tracking where it could be, I tell them don't bother about that. It is difficult. So let's just do a number of exercises. And if you notice that it really feels good for you to do some of the exercises tiny small or just small, then you're starting to track parts of your body that very likely have hyper response in them. You get it? So instead of going for tracking it directly, you go for tracking it by doing something small and noticing how that works for you.
So do you want to give an example of one such exercise?
Yeah. Now I already mentioned the one with the legs.
Mm-hmm.
So we can do one with the arms instead. I'll lift my arms to show what I mean. You put your fingertips together, right? But do it in your lap. So let your shoulders relax and then just put fingertips together. And then just try out the possibility of letting them push gently, small into each other. You can also do it with more strength, then it may get a little clearer to you which muscles activate. But what activates is the whole front side, both the connective tissue and the muscles in your chest and your stomach. And then experiment with dosing it. Just check out, is there any dosage that in some ways feel better in your body than another dosage? Right? And then to have something to compare with, we can do the other side of the trunk, which would be activating the support muscles in the back. You can do that by making your elbows move just a tiny bit backwards. And if you want more, kind of more physicality to it, you can put your fingers like this and let them pull outwards, right? Again, in your lap. And that little movement activates the whole support system in your back. And again, you can play with dosing. You can do it tiny little, with or without the fingers. And one way of looking for functional dosage is also paying attention to your breath. Because if you find a good dosage, the tendency is that then it feels easy to breathe. Mm. If you sit there and struggle in any ways, and your breath is contracted or you barely breathe, you haven't found a good dosage. And then you either try to do a little more or a little less. And for many, many people, this thing with training to do less is a whole learning process in itself, because we're so trained in that when something is difficult, we need to do more.
Right.
And you very often benefit when something is difficult, try to do it smaller.
Yeah. And so that sense of it is, I've been doing it as you were describing it. Mm-hmm. And I noticed for me, the larger effort felt more satisfying. But on the other hand, the smaller effort, I had more of the perception of what was happening. I
Yeah.
was more in touch with
Yeah.
um, so in
Yeah.
some way it felt bigger.
Yeah. Yeah. There is that, you know, I very often have the same doubleness myself. Part of me really likes using physical power. I have a quite strong body and I like using it. So I can get energy from using my strength, and I get a certain fullness in my muscles with that. When I do it much smaller, I get to a more subtle awareness of my own body. And I also get parts of me engaged that don't engage when I use more power. So I think many of us have that doubleness, right? That it's not an either or. I mean, it's not wrong to use our physical power. It just plays a different role,
Mm-hmm.
right? And if we know that and we are used and we like that, we need to learn to go for the other part also, because it's so easy to not go for that.
Yeah.
No, so that's what I train people in. It's to be able to access both.
Mm-hmm. Yeah. 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 Yeah.
Yeah.
Yeah. Yeah.
And it is more subtle. The low dosing is a subtle sensation. And you called it that it feels that there's a bigness to it. And I'm with you in that. It's like when you activate something really gentle or gently, there's an expansion in it. So then, having done these two exercises, I would always ask people, so what was your preference? Right? Which one? I would ask a group. So who of you liked the one with the front side, the fingertips? And then I would ask, so what kind of resources did you gain from it? Right? And very typical answers would be, I feel more gathered, I feel more protected, I feel more centered. And it's logical. I mean, there's no, you activate the whole front side, which means that you get a better boundary on your front side. You literally physically gather yourself. And then others will like the support from the back, and typical words for that would be that what do they say? They say that they feel strength often, or they carry themselves better. They straighten up in a natural way, or they can lean into their backs, or words like that.
Yeah. 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 Yeah.
But the method in the methodology in it is that it's important that people choose. You
Mm-hmm.
know, again, because in the flaccid parts, that's what we lost. We
Okay.
lost our capacity to choose.
Yeah. Yeah. So that's a sense of exploring
Yeah.
the possibility
Yeah.
beyond the current state
Yes.
and noticing what really feels right
Yeah.
uh, in order to focus on that. And so
Yes.
that's what helps you get that sense of not just grounding, but also orienting.
Mm-hmm.
Because in that sense is I am, I want.
Yeah. Yeah. Grounding, orienting, containment, possibility to take action, and possibility to feel. Because sometimes there are also emotions that emerge. As soon as you get more gathered, you may get access to what emotions it was that you left behind.
Yeah, I would assume
Suddenly,
it's possible to find
yeah,
that kind of engagement without having some
yeah,
emotion. Yeah.
yeah. But it may take time. Sometimes it takes a while before the information is available. And I think that again is a difference between working with the tension or working with the low energy.
Mm-hmm.
The low energy process is slower, also in accessing what is lying inside of the strategy. The information comes slower.
Yeah.
Yeah.
Yeah. Yeah. Because it's absent in there.
Yes.
I want to touch briefly upon the difference between this and hypoactivation of the ANS.
Yes, I'm with you. I thought of the same. Yeah. Reactions in the autonomic nervous system, they are in a way, they impact the totality of the body, and they impact the physiology. So they impact your temperature regulation, your heart regulation, your much bigger systems, not only the muscle system, right? So they are, and we can't. They are not happening from our consciousness. They are instinctive, right? So you can't discuss with your autonomic nervous system. It does what it does. So the benefit of working with the muscles is that if you gain more fullness of your muscle system, it helps regulate the autonomic nervous system, right? So if we look at this difference between hypo-response in the muscles and hypo-arousal in the nervous system, if you're close to hypo-arousal, you can have experiences of real collapse, right? Kind of a total collapse. How do we approach that in a way where we don't just jump into the abyss? How do we actually start integrating an experience of collapse? And that's where I start with working with the lower degree of giving up, which is in the muscle system, so that you get a better container. And then in an image, we can sit together on the edge of the abyss, starting to get to know the collapse. But that needs presence enough in the here and now. And that's very difficult to hold if a lot of the muscle system is in flaccidity.
Right, right.
Then if that's the case and you approach a collapse, then you're going to fall into it, which
Right.
I do think is why a lot of people are afraid of the experiences of collapse. It's that you get pulled into it. And that's where I slow down that process by training this subtle awareness of the body and being able to hold that. So you don't need to polarize to the collapse, and you don't need to try to get away from it, and you don't need to drown in it.
Right.
You can actually sit and stay present.
But so what we're talking about,
Did I answer your question?
I want to make sure that I heard
Okay.
you correctly, so I'm going to repeat, in
Good.
my words, so that in a situation of ANS collapse,
Yeah.
there is that pull toward the abyss, and
Yes.
so to avoid that, to facilitate working with it, what
Yeah.
you would do is not work with a total ANS collapse, but focus on a specific group of muscles on
Yes.
a more localized area,
Yeah.
so as to give the person the training to
Yeah.
see that it's possible to feel a localized collapse and to feel restoring energy to it.
Yes.
And so in that sense, build up the faith in the possibility of being in the presence of collapse without falling into it.
Mm-hmm. Yes, you got that. And that work is, you could say, it's both working with the muscles, but it's also doing it in a relationship. The relationship is, we haven't talked a lot about that, but the relationship is actually a big component in being able to energize these flaccid muscles again. It's my acceptance, or the therapist's acceptance and normalization and inclusion of low energy, that makes it easier for the client to do it. And that dynamic really matters if we are close to a deep giving up. My faith in that, I know that I can sit here on the edge together with you, and we can look at the collapse, but we don't need to fall in. And we do that by doing small, gentle, precise activations in our bodies. And we do that together.
Yeah. So maybe I'm repeating this thing. We can sit at the edge of the collapse without falling into it.
Yes.
Because what we are doing is we practice together, observing in limited areas of the collapse and activation and feeling the energy. And so together we build that capacity to stay at the end of it. So that feels like a good place. Does it feel like a good place to end, or would you want to add something?
No, I like ending here.
Okay. Thanks, Merete.
Yeah.